y'all for having us here. We're from the Orange County Rape Crisis Center located here in Chapel Hill, North Carolina. And we are excited to be applying for our first Capstone team. We have not had folks come to our agency before, and we're really excited about the potential of having people with us. My name is Laurie Graham. I'm the Programs Director at the Orange County Rape Crisis Center, and I have one of my colleagues here with me as well.
Hi, I'm Rachel Valentine. I'm the Rape Prevention Education Coordinator, and I coordinate the prevention education programs at the Orange County Rape Crisis Center, and I'm going to tell you some more about that once Laurie tells you a little bit of background about our agency.
I'm going to start by talking just a little bit about our agency and our structure. So we have these main 4 areas of program or services, and we have our community education programs, our support group program, Latina Services program, and crisis response program. This project focuses on our community education branch, but to give an overview, all of our services and crisis intervention services are offered in both English and Spanish, and we provide 24-hour crisis intervention services through a helpline. We have support groups that we offer about 10 to 12 of those throughout the year. We also provide accompaniment services in various ways to different community partner agencies, whether it's for reporting, seeking health services, or other various needs that folks are having who have identified as survivors of sexual violence. As far as the issue that we are focusing on as a part of our services for this project is we know that 1 in 4 girls and 1 in 6 boys, based on CDC research, have experienced childhood sexual abuse before the age of 18. And something that we are doing with our community education program is trying to address this community health concern and try to work with our programming to prevent the perpetration of sexual violence as well as the victimization that's occurring nationally and specifically in our community.
So our community education programs have been active in the Orange County and Chapel Hill Carrboro City schools for over 30 years. And there are 2 different districts in this county here. One is the urban district that most of the folks around here who live in the Chapel Hill area are a little bit more familiar with, as well as a rural district, which is actually quite a large district and sort of demographically very different. But we work in both districts and have for over 30 years. We've got a really strong partnership, and that the reason that I think that's important to know is that our prevention programs are community-based, and they've been developed in partnership with the stakeholders in these school systems and have been adapted over the course of these 3 decades based on the needs and interests of the stakeholders in the school systems, as well as reflections on sort of what is best practice in prevention of child sexual abuse. And more recently, in the last 6 years, we've been working through a grant, the Rape Prevention Education Grant, to transition our programs from being more of a community education and social justice-based program to bring them more into compliance with public health models for what effective primary prevention looks like. So neither Laurie nor I, nor anyone from our agency really comes from a public health background. We're all social justice background, feminist activism, community education, but we know that there is a lot of overlap with public health. And so we're really excited to try to find some ways to bridge that and to work with you all to help us understand what some of the public health, what public health can offer to us in terms of looking at our programs. So the primary program that's kind of our flagship that we're most well known for in the school system is our Safe Touch program. And this is a program that works on developing specific knowledge, attitudes, beliefs, behaviors, and skills with children in grades pre-kindergarten through 5th grade related to privacy rights, knowledge of their own bodies, knowledge of their own rights, the ability to determine the difference between healthy and unhealthy, good and safe and unsafe touches, as well as identifying positive relationships with adults. around them. And we do that in a way that we try to make socioculturally relevant, and well-timed. We use puppets, so it's actually not as scary as people think it's going to be when we talk about child sexual abuse with young children. The puppets we use in pre-K through 2nd grade. After that, we start moving on to videos and a little bit more interactive stuff, because the puppets are kind of, well, you all like them, but after that, in the middle school, we start collaborating with other agencies in the area, particularly the Compass Center for Women and Families, on doing multi-session programming with middle school students. And this is focused on the primary prevention of perpetration, peer-to-peer perpetration of sexual violence. So we're working on them on developing healthy sexuality, healthy flirting, healthy dating skills. We do a lot of stuff around consent. Only yes means yes. 6 lucky people who come visit us first and get so these are our classroom-based interventions. These are augmented by parent education and empowerment programs that we do, because we know that the individuals who are in our classrooms exist within relationships with adults around them, as well as professional development and policy and practice work that we are attempting to influence the school systems and how they're working to keep kids safe. And that's also, we also are working towards developing some more sort of community-level interventions around social norming around consent is our major one right now, which is what these bracelets represent. So from our community-based education model, it's starting to look more and more like a socio-ecological model. Yeah. So we're getting there. Primarily what we're asking folks to help us look at, is looking at our classroom-based education, because we're really looking at the principle of sufficient dosage and what represents sufficient dosage. Our elementary school programs are once a year, but they're every year. And so we're looking at the question of, is that effective? Can every year, over and over and over again, approximate sufficient dosage?
And we are running out of time. It goes by really fast. So I'm going to, these are some of the ways that we hope a capstone team could assist in improving our program impact and outcomes, as well as improve our program sustainability and potentially attract further evaluation. We're very hopeful because we have a program that differs quite a bit from programs across the country, that we could potentially influence the broader prevention literature with research done on our program. And since we're located in a community with so many resources and university resources, we would like to attract that evaluation. Augment our ability to export our program as well to other communities. As far as the deliverables, they include an updated evaluation plan, developing student surveys for 4th and 5th grade students specifically, and helping with the implementation of those surveys. Potentially. Student and staff interview guides, so we want to do focus groups with students and key informant interviews with staff, as well as have a final evaluation report that looks at both the quantitative data that we're collecting and the qualitative data, and presents that in a way that can help our intervention stakeholders learn a little bit more and do some presentations for both our staff, our board of directors, as well as folks in the community. And these are the skill areas. So if you would like to learn more, come talk to us.
Or get a bracelet.
Or get a bracelet, that's fine.